Imagine waking up one day and your own body feels like it's betraying you. Your muscles lock, your spine stiffens, even the simplest movements feel impossible. And a single loud sound or sudden emotion can send pain surging through your body like electricity. This is the daily reality for people living with stiff person syndrome, a rare neurological disorder that shocked the world when Céline Dion revealed her diagnosis in 2022. In this video, we're going deep. What SPS is, why it's so misunderstood, how it affects the body and mind, and what treatments are available. By the end, you will understand why Céline's struggle isn't just a headline, it is a glimpse into the life of thousands of patients worldwide battling an invisible, devastating disease. Welcome back to the Psycho Nurse, the place where we make complex medical, neurological, and psychological conditions easy to understand. Today, we're exploring one of the rarest disorders in the world. SPS affects about 1 in a million people, but its impact is profound, lifelong, and often misunderstood. We'll cover the science behind the disease, the early warning signs, the psychological and social impact, modern treatments, and of course, we'll take a closer look at how it has affected celebrities like Céline Dion. So, what is the medical science behind stiff person syndrome? SPS is classified as a neurological autoimmune disorder. Let's break down what happens inside the body. Normally, your immune system protects you from infections and foreign invaders. But in SPS, it misfires. It mistakenly attacks the nervous system, specifically targeting the parts that control muscle movement and, crucially, muscle relaxation. Research shows that many people with SPS produce antibodies against something called GAD, or glutamic acid decarboxylase. This is an enzyme that's critical for producing GABA, which is the main inhibitory or calming neurotransmitter in your brain. GABA's job is to tell your muscles to chill out. Without GABA's calming influence, muscles start firing uncontrollably. This leads to constant stiffness and sudden, painful spasms. The neurological consequences are severe. Sufferers experience a loss of posture control, which can lead to a hunched-over stance. They can have tremors or jerks and extremely painful muscle contractions that feel like a full-body Charlie horse. Walking or even just standing becomes incredibly difficult. So SPS isn't just about feeling a little stiff, it's a neurological storm raging inside the body. The symptoms of SPS can vary from person to person, and they often start very subtly. The early signs might be a mild stiffness in the back, abdomen, or legs. You might have slight difficulty relaxing your muscles, or feel tingling and prickling sensations. Many people also experience anxiety that seems linked to this muscle tension, but they can't quite put their finger on why. As the condition progresses, the symptoms become much more severe. This can lead to full-body rigidity and severe, painful spasms that can be triggered by the smallest things, like a sound, a touch, or a stressful thought. Walking becomes a major challenge, often resulting in a hunched posture and a high risk of falls. Many patients develop a fear of movement because they're terrified of triggering a spasm. They often describe freezing in place, sometimes for minutes at a time, with the sensation of being completely trapped inside their own body. Imagine not being able to move a muscle, even though you're consciously trying to. One case study described a 35-year-old woman who reported waking up with muscles so stiff she couldn't bend. She said her back felt like concrete, and something as simple as a cough would make her entire body spasm violently. This brings us to Céline Dion, whose diagnosis became public in 2022. It explained her sudden and prolonged absence from the stage, and the news sent shockwaves around the world. For a world-class singer, performer, and dancer, SPS is especially debilitating. Think about it. Stiffness in the diaphragm directly affects breathing control, which is the foundation of singing. Muscle rigidity makes the fluid movements required for a stage performance almost impossible. And unpredictable spasms could interrupt a song mid-performance in front of thousands of people. Céline herself has mentioned specific triggers. Things like emotional stress, loud sounds, sudden movements, and even cold temperatures can set off her symptoms. Imagine rehearsing for a world tour where every moment is high stakes, and knowing that your own body could freeze or spasm at any second. It's a terrifying reality that highlights just how devastating this condition can be, especially for someone whose entire career depends on physical control and expression. So what causes SPS and what are the risk factors? We know it's an autoimmune disorder, meaning the body attacks itself. The key factor we often see is the production of those GAD antibodies we talked about earlier. These antibodies attack the neurons that are supposed to control muscle inhibition. It's also common for people with SPS to have other autoimmune conditions, like type 1 diabetes, thyroid disorders, or vitiligo. However, for some patients, there's no identifiable cause at all, and research is still ongoing to understand all the potential triggers. One of the most frustrating things about SPS is how long it takes to get a diagnosis. The symptoms often mimic other, more common conditions like anxiety disorders, Parkinson's disease, multiple sclerosis, or fibromyalgia. Many doctors see stiffness or spasms and initially assume there's a psychological origin. A study published in the Neurological found that the median time to get a correct diagnosis for SPS is a staggering 6 years. 6 years of confusion, pain, and uncertainty. Let's talk more about the triggers that can make symptoms worse. For someone with SPS, the world can feel like a minefield. Symptoms can flare up unpredictably, and common triggers include sudden noises like a car horn, an alarm, or even just applause. Emotional stress or fear is a huge one. Changes in temperature, particularly cold air, can cause muscles to lock up. Even a simple, unexpected physical touch can set off a spasm. Because of this, patients often start to avoid crowds or social situations. The fear of having a painful or humiliating spasm in public can lead to intense social isolation. Now, what about treatment? While there is no cure for SPS, there are multiple therapies that can help manage the symptoms and improve quality of life. On the medication front, doctors often prescribe benzodiazepines to help relax muscles and reduce spasms. Other muscle relaxants like baclofen and various antispasm drugs are also used. Then there's immunotherapy, which aims to calm down the overactive immune system. This includes IVIG, which is intravenous immunoglobulin. It helps reduce the autoimmune attack on the nervous system. Corticosteroids can be used to suppress inflammation, and in some severe cases, a procedure called plasmapheresis can be done to literally filter the harmful antibodies out of the blood. Physical therapy is another crucial component. Gentle stretching helps maintain mobility, while targeted exercises can strengthen weak muscles. Therapists also work with patients on strategies to prevent falls and injuries. And we can't forget mental health support. Because stress is a major trigger that worsens spasms, therapy is absolutely essential. Cognitive behavioral therapy, or CBT, can be incredibly effective for managing the anxiety that comes with the condition. Mindfulness practices can help patients manage their triggers and stay grounded. And support groups provide a vital social and emotional outlet, connecting patients with others who truly understand what they're going through. The psychological and social impact of living with SPS is immense. This isn't just a physical disease, it takes a huge toll on the mind. Patients often live with chronic anxiety because every movement is a potential trigger for pain. Depression is common, stemming from the physical limitations and the drastic changes to their lifestyle. Some even develop a form of post-traumatic stress after experiencing particularly severe spasms or injuries. This leads to social isolation driven by a fear of having a spasm in public. Many patients develop phobias related to movement, leaving the house, or being in crowded places. This is why mental health support isn't just an add-on. It's just as important as the medical treatment. Even though stiff person syndrome is rare, awareness is growing, and that brings hope. Celebrities like Céline Dion are using their platforms to raise public awareness, which is incredibly powerful. This increased visibility helps drive medical research, which is now focusing on things like GAD antibody modulation. Patient advocacy groups are also providing incredible resources and building communities to help people cope. There is hope for patients. Some respond very well to treatments like IVIG and a combination of therapies. Getting an early diagnosis dramatically improves outcomes. And the best approach is always a holistic one combining physical, medical, and psychological therapy to increase the quality of life as much as possible. Stiff person syndrome is rare, debilitating, and often invisible, but knowledge is power. By learning about SPS, we can help reduce the stigma around invisible illnesses, encourage faster and more accurate diagnosis, and better support patients both physically and mentally. If you learned something new today, please give this video a like and subscribe to the Psycho Nurse. Let me know in the comments, which rare disease should we explain next? Stay informed and stay compassionate. Until next time, this is the Psycho Nurse.